I'm Alison Paprica. I'm the Vice President, Health Strategy and Partnerships at the Vector Institute for Artificial Intelligence, and I'm going to be the facilitator for our lunchtime keynote panel on the topic of barriers and facilitators to getting AI from innovation to healthcare markets. And I will just point out there's an abstract, which I'm not going to entirely read. It's near the back of the program, and I'll just sort of paraphrase some of the stuff in there. So the reason that we want to have this panel is, it doesn't matter which of the many reports you read or reviews you read, you will find that we have a huge amount of health AI activity in the research sector, but very little making it into practice. So our goal for this panel is not to talk about, the high-level concepts of, a list of barriers, a list of facilitators, but to get as concrete as we can in terms of what would it take to get some of these things that appear to be promising in research into practice. The format we're going to have, as indicated by the fire, is quite informal and will end with us closer to being on track for the program, where each of our four panelists is going to talk a little bit about an AI technology that they're either involved in or aware of, and specifically why they think it's promising and what barriers or challenges there may be to getting it into practice. So I have with me, and I'll just introduce them by name as opposed to the full details and in the order they're going to present. I have Frank Rudzicz, who is a Vector faculty member at University of Toronto, but speaking today largely with the hat of the companies that he's involved in that are actively working on AI. Dr. Kumanan Wilson from the University of Ottawa, who is going to speak about something that's kind of on the verge of getting into, having AI, if I understand, yeah? Mari Teitelbaum, who's going to speak about her involvement in data sets and data that has potential for AI and where we think it's going to go. And then Patricia is going to end it off more speaking, reflecting on what she's heard from the other panelists and other sort of specific things that are important in terms of barriers of facilitators. Then we'll have a little dialogue between the panel members, reacting to each other, and some time for Q&A with the participants. So without further ado, our first panelist is Frank.
And I think it works. Testing, yes. So first I want to apologize. So I have a really nasty cold and it kind of hurts to talk, so I'm not going to talk for too much. I'm going to try to protect the microphone for the next speaker. But if it doesn't work, also apologize. But enjoy your day off next week. I'm a professor at computer science at University of Toronto and at the Vector Institute, but like Alison mentioned, I think I'm here because of the companies that I'm involved in. So one of them is Winterlight Labs. So they use natural language processing to look for signs of dementia and depression in the voice, and they're working with long-term care facilities and pharmaceutical companies to deploy that technology. And the second company is Surgical Safety Technologies, which is using machine learning and a wide variety of data sources in the operating room to make surgery safer. So I'm also the Canadian chair of the International Standard Organization's Subcommittee on Artificial Intelligence, where I see kind of firsthand what the international community is trying to do with regards to the standardization of AI. So I scribbled some notes this morning about some hurdles and some facilitators to get this kind of technology to practice. So the first hurdle is basically data. So in both of the companies, we started from academic environments. So we kind of collected our own data, and we used public data sets and challenge data to get those companies off the ground. But large companies have a much easier time gathering data than we do. Our data sets are relatively small, and it actually remains a challenge in a lot of cases to obtain data that's useful to train the machine learning algorithms. The second hurdle is somewhat self-imposed and has to do with this kind of notion of push versus pull. It's a lot harder to have a bunch of computer scientists basically develop machine learning algorithms that we think are cool, and then after that go into the field and try to convince physicians and surgeons and that kind of stuff to use it. It's much better when we get requests from clinicians or physicians to develop something that they think would be useful to them. So I think the hurdle basically is computer scientists working in isolation and not knowing much about or not understanding the market for the technology they're developing. And the third hurdle is kind of a persistent lack of understanding about what machine learning is. I think there's a quote that I modified from Richard Feynman, which is, if you think you understand machine learning, you don't understand machine learning. I think we all understand bits and pieces of it, but like was mentioned earlier, the big picture and the blind spots are something we all struggle with, everybody. So I think engineers, to some extent like myself, or computer scientists, need to take off the rose-colored glasses a little bit and put down the Kool-Aid and look to some issues in machine learning. But also I think, let's say that everyone else, the public at large, also needs to also understand that they have blind spots too. So the recommendation might be too much to ask, but it's a good idea for you to talk to computer scientists and learn a bit more about what's going on under the hood. So for facilitators, I think for me, one of the major facilitators has been basically these enzymes between government and industry and academia. And I'm thinking in particular of the Vector Institute and the great work that Alison is doing there. To kind of tear down the first hurdle, the access to data to some extent. And this is also, we're very grateful to the institutions that we're working with, especially ICES. And the second facilitator that I see is helping to get this sort of technology into practice is something I haven't heard about yet today, which is explainable AI. So often AI is referred to as like a black box and it's very mysterious. We don't know what's going on inside, but that's not really true. There's a subfield of machine learning that literally is focused entirely on opening up the black box and figuring out what's going on under the hood in a way that makes sense to us. It's still kind of the Wild West. There's very many approaches to this, but as the technology matures and gets more standardized, I think it's going to increase trust if we can understand specifically why decisions are being made clinically.
I think we do it for you.
Oh, okay, great. Thanks for inviting me to talk today. So I'd like to begin with a question for the audience. Who here knows where their immunization yellow card is? Hands up. Okay, who here knows where their smartphone is? Hands up. So we put that immunization yellow card on your smartphone. It's called Can Immunize. If you guys haven't downloaded it, here's the plug. Please download it. We actually did that in 2011, 2012. It's an immunization app that allows you to track your vaccinations, be reminded of upcoming appointments, gives you accurate information. It was the first of its kind when it was developed. Actually, Apple contacted us and said they've been waiting for someone to build this. It seemed like an obvious thing for someone to do, and they gave us some advice. And then CBC National contacted us and said, hey, this is really cool. I just talked to a mother in a park. She gave me this idea. I paid $5,000 to a first-year engineering student who taught himself how to build it. And so we got this product out, and CBC National wants to do a story on it. It turned out the story was actually all about privacy and what are we doing with the data. And fortunately, Mari here was able to bail me out at the time and put me in touch with some privacy lawyers, because at that time we really hadn't thought a lot about it. And I mean, it's 2013 and we're now just really getting into the details of some of these issues. Unfortunately, it turned out we were okay at the time. We had provided a solution for people to manage their own health data. We had advised them of the risks and give them a method to protect it. But we really didn't know any of that. We got a little lucky at the time. But the product was successful. It's now pan-Canadian and it's a sort of Canada's national immunization app. We allow reporting of immunization status in several jurisdictions. But then the next stage was we were going to start to store that data through an account-based system. And fortunately, Amazon had just created some web servers in Canada, which apparently makes it easier from a privacy perspective to store the data as long as it's on Canadian soil. And so we were actually one of the first to use those servers to store the data. But then that brought into a whole bunch of other privacy issues, because now we were holding personal health information. And again, I really didn't know what to do, but we were able to, thanks to Colleen's group, get a lot of help on that. And we did a privacy impact assessment and a full assessment. And it turns out we actually fall in a gap in the rules. So we're not a healthcare data custodian, so we don't fall under HIPAA, and we weren't a private company, so we didn't fall under PIPEDA. We were an academic center creating a solution. So the law actually didn't apply to us, so we didn't really know what to do, but we went with PHIPAA and a full consent-based solution. And I believe it, I'm not a privacy lawyer, but I think we did it before EU GDPR, and we would have met all their standards. In fact, we probably went a little too far. We have a very thorough privacy disclosure at the beginning of our app, and when we launched this new format, we were able to follow on Google Analytics, and we started seeing that people were dropping off when they hit our privacy because there were just too many screens to go through. And I think that does point to another issue, that privacy is really, really important, but getting your data is really, really important as well. And in fact, the information we got when we launched it the first time, doesn't somebody already have our data? So while people don't want people to get their data without consent, they also would like someone to have their data at some point in time. And that's actually probably a bigger frustration in the health system right now. So we were able to simplify our privacy system so that people could get the information about what they're consenting to and then get to use the app. And so now we're sort of in the next stage of moving that data around, integrating with provincial systems. And we're also adding additional features like allowing people to track their medications and track early childhood development features. We're going to be integrating Project Big Life and the Respect calculator that built out of ICES. And then this is where opportunities for AI come in because, from all of this data, we may be able to identify who's most likely to miss a vaccination or not have a series completion, and then sort of target those people and give them prompts to remind them in advance, and hopefully in the process improve immunization rates. And I think I'm glad to hear a lot of the work going on here, but I feel like because we weren't so thorough with the privacy up front on just storing the data and our consent-based policy where we allow people to withdraw their data at any point, as long as we maintain that transparency, I feel like we should be okay moving forward, but I guess the regulatory landscape is evolving in that, so we'll see. Thanks.
Good afternoon. Since Koom started with a question, I'm going to start with a question. Anyone here have the opportunity to see Obama speak at the Canadian Tire Centre last night? Raise your hand. Woohoo! Okay, so it was wonderful. And I was sitting there and he was talking, and when I woke up this morning, I realized there was a connection between what he was saying and what we're talking about today. So bear with me for a moment. So he did spend a fair bit of time on technology. He was interviewed by Toby from Shopify, who obviously has a bit of bias in that direction, and Toby asked him a lot of technology-related questions. And he came back with the normal answers around we're always nervous when new technology is presented to us, whether it's the printing press or the car or the internet or social media. There is a time of adjustment. And he commented that you need to have smart conversations as this happens to bring society along as these technologies are presented. So firstly, thank you. You're having those smart conversations that Obama said were required as it relates to AI. And for that, those of us who live it every day are very, very grateful. Another thing he talked about that really caught my attention was education. And he talked about how our current education system was built for the transition from agriculture to the industrial age. And this concept of having kids sitting in a row looking at a blackboard was great when at the end of it all you wanted them in a factory line or in front of a typewriter or a sewing machine or something like that, but it really doesn't work for the world today. So when I listen to Kumanan's frustrations and I look at all of you in your expertise and talk with some of you over the snacks, there is a chance that the frameworks we have, be it PHIPAA, PIPEDA, whatever else, actually isn't going to work in this brave new world. I don't know how we have the conversation to find the right solutions, but are we really solving the right problem? I would just put that out to you as you continue your conversation today. But as we get to the more practical, I do work in a hospital. AI is fast and furious everywhere, and it is absolutely a buzzword. We are going to market now for a new PACS. So in radiology, hundreds and hundreds of studies every single day. We store mountains and mountains and mountains of data. If ever there were a use for AI, it would be radiology. I tried to collect some stats, remarkably hard to find, but I found, or I've heard from some who know, that in some radiology practices, for every one read they do that actually has a problem, there's 13 normal ones. So you're reading 13 perfectly normal studies for every one abnormal study. So if ever there was an application of AI to bring those abnormal ones to the top of your list and leave the normal ones for later because any type of delay probably wouldn't matter, this seems ripe for that, and it is happening. You can't buy a PACS today that doesn't have some sort of AI embedded in it. So if we're going to talk enablers, healthcare is used to triaging. Healthcare is used to taking the issues that are the riskiest, bringing them to the top of the list, and working on those first. And really, if AI is used in that way, it's going to be very, very quickly adopted. And that's not just in medical imaging and that type of thing. You can use it in dermatology. You can use it in your ICU as you identify patients that are at higher risk. Anything that helps organize the work when we know resources are stressed is going to be seen as a positive and actually not a threat. Of course, there are the barriers, and you guys have talked about them, I'm assuming, for the past day. I've already heard them 5 times in the hour and a half I've been here. People are worried about security. People are worried about bias. People are worried. The most interesting one I heard was echo chamber. So this concept of if you're informing the AI, it's actually going to be so smart, it's going to figure out what you want to hear, and there's going to be this embedded bias of the answer you're expecting to get. So all of these things that you guys are spending a lot of time on are absolutely the barriers. But to be quite honest, the enablers are quickly outweighing those concerns, or the benefit of it is quickly outweighing those concerns. Did I answer the question okay? Okay.
Alors, merci de l'invitation. Merci Colleen et Florian et Giles pour tout le travail qui a été fait pour cette belle conférence. Et nonobstant mon grand enthousiasme pour le sujet, je vais me retenir à 7 minutes et je vais répondre très spécifiquement aux questions de Alison. So I'm going to address, I'm going to try to sum up what I think are the challenges for emerging companies in this space today, the compliance, practical compliance challenges, the regulatory challenges, and the trust challenges. At a very practical level, I think it's fair to say there's a general lack of awareness of applicable privacy laws among startups and emerging companies that don't know what they don't know. Kumanan being an exception of that, of course. As colleagues recently pointed out to me, the Collision 2019 conference that was just in Toronto, as incredibly exciting, novel, and inspiring as it was completely devoid of privacy sessions in the program, and I could understand why. I mean, I wouldn't want to give a privacy talk at that conference. I'd feel like a real Debbie Downer. When emerging companies do reach out for legal help, the hardest challenge is getting started. As I've just returned to private practice about 1.5 years ago, of course, I was reminded at how expensive legal advice is. And a sizable portion of time is consumed in just getting them to identify and describe data inventories and data flows in order for privacy lawyers and privacy management consultants to be able to actually assist them. And there's currently very little incentive to expend what are very limited dollars on this unless and until their lending institutions or investors or insurers require that they cross their privacy P's and Q's, so to speak, as a means of mitigating undue risk. The regulatory challenges we've talked about, it's been raised, these are pivotal times in terms of regulatory policy making in the area of privacy, and the ground is literally shifting under our feet. GDPR, as we know, in the EU, has been a real game changer in elevating privacy standards for everyone around the world, and it is big and complex enough to gobble up any small startup in its wake. Canada and the rest of the world are re-examining our laws in light of the GDPR, particularly given the desire to achieve adequacy with the EU standards in order to facilitate ongoing trade. And nobody's mentioned it, of course, but sleeping giants have been awakened by the Cambridge Analytica affair, and policymakers are in active response mode. So the government's recent reform proposals are a good example of a bold and wholesale rethink of the kind of privacy regulatory regime we need for our digital age. There are really interesting concepts like fiduciary care, data trust being introduced, a lot of emphasis being put on codes of practice and accreditation and certification schemes, regulatory sandboxes, containers are all wonderful opportunities if we grasp them, for more agile, modern, and nimble privacy regulation. But in the meantime, we are in a very strange period between and betwixt two worlds where regulators are interpreting laws not only as they stand today, but as they anticipate they are going and where they wish them to go, which is contributing to the current state of unpredictability. And lastly, the trust challenges. There is a market for hope, and there is a market for hype. And until things go wrong in the Wild West, it risks setting back progress and ruining it for other more responsible actors in the marketplace. And there's a healthy and welcome conversation being drawn into the mainstream now about the need for broadening traditional privacy impact assessments into broader ethical impact assessment. And I think that happens to be a very positive development, though I recognize it's going to be a very slow and incremental process. Organizations, small and large, I think, need to start getting comfortable with the idea of some form of ethical assessment, which may be difficult to accept in a rapidly changing competitive environment that, as we've heard, is extremely heavily regulated as it is. But unless it's done in a responsible, agile, and nimble way, it could seem like the beginning of a regulatory or bureaucratic trappings that risk completely stifling innovation and will not be accepted. So it'll take resources and commitment from senior ranks of the organization to support this process and consider its resulting recommendations as value added to their business proposition. It's going to take interdisciplinary perspectives around the corporate table, much like we heard Jason describe, and may eventually have to also include diverse voices, yes, even from outside the organization, to show greater independence and objectivity. And it's going to take training to ensure persons charged with carrying out these ethical assessments have the requisite skills. Specialized foresighting methods will need to be taught to try to imagine the unimaginable and anticipate and address future risks that AI may bring. And here we can probably take a page from our Indigenous elders who can teach us how we even begin to consider the downstream impacts of our decisions on 7 generations to follow. I can't even imagine what that means. Difficult conversations are going to be had about how transparent these processes have to be, and the decision-making authority of those who carry out the assessments. Will they have the power to turn off or turn down projects? Will they have veto power, or will they be advisory only? Some organizations have started instituting these ethical advisory boards, and their processes are far from pure and perfect. And the practical reality, in my view, is that you have to start somewhere. And while we certainly should not be condoning ethics washing, we should be supportive of these small incremental steps being made in this direction, recognizing how challenging it's going to be to achieve enlightened and credible ethics assessments in a way that will eventually gain the trust of regulators, consumers, and the general public. And my last point has to do with something that was raised yesterday evening, and I think it is tempting to think that we still have time to work this out. But I believe, given my current job, working with private sector and seeing how fast things are, and my past perspective as a regulator, I think things are actually moving incredibly fast, and there is a sense of urgency. And I don't think we should lull ourselves into a sense of complacency too long. Please join me in
That was just fantastic, all of you. Thank you so much. We talked at a high level about what people were going to speak to, but I couldn't have asked for a better panel. And again, grounding things in real things that we can do, training, guidebooks, etc. So as promised, the first thing we're going to do is, just now that the panelists have heard each other, see if there are any questions they want to ask each other primarily, any thoughts that have been sparked.
I mean, I'll just, from the perspective of a developer, the reality is what happens is, we're trying to be agile, and we create a solution, and then we get feedback and requests, and the product's always changing, and it's rapidly changing. And the idea of having to repeatedly do privacy impact assessments and everything along the way, I mean, we had a decent amount of funding from the federal government, but I can imagine this really being a limitation for a lot of companies with products that are constantly evolving. And then, there's also the issue the law, it's hard to change laws. And I think when PHIPAA was probably pre-smartphones almost, I just wondering if anybody had any suggestions on how we can make like you said, the law more agile, the regulatory process more agile, to facilitate the developers who are always in this agile process.
Well, I can start. I think increasingly, and you can see this in the reform proposals, I do think that we're moving towards, or we may possibly, and for the better, I think, be moving towards risk-based regulation. And just as, you don't have to, I think, invest all the resources, maximal resources for every single project, but you need to have a way of assessing the incremental risk. And for those higher risk projects, I do think you need to put in the commensurate efforts to carry out both the privacy, but increasingly the ethical risk impact assessment. So I think we need to, take a page even from your perspective, be more agile, and treat and regard these things from a risk-based perspective.
I'll go with one. One of the things that I find challenging in some of these discussions is it's all talk about negative risks, which are, of course, important. I want to emphasize I'm not condoning any kind of reckless behavior. But these negative risks only make sense, it only makes sense to take them on in the context of some benefit that you're seeking, right? And so it's what Bartha Knoppers refers to as the human right to benefit from science and its applications, which is a UN-enshrined human right. So, and regulators and other sort of, there are policy strategy approaches where we get at this, where some benefit we're not realizing. So the Orphan Drug Act in the States, for example, does that need to be part of it, that we have sort of a fast track and special way to mobilize around technologies that we really think are going to bring a benefit, that have low risk of harm, or like AI-enabled coma detection is my favorite one to hold up. There's no downside. If you get it wrong, the person still comes out of a coma. If you get it right, family and staff can be more ready. There is no downside. So what do people think about that? Because I'm hearing as well, as is often the case, there's a strong benefit that you're pursuing that drives all of this. And I don't often hear that automatically in the privacy and legal discussions.
So I'll jump in on that one. When we were having our discussions at CHEO, an area that people got really excited about was the fact that most drugs are never tested on kids. And the concept of actually leveraging AI to do a level of due diligence on drugs, procedures, and everything else on populations well beyond the ones we traditionally access. And so there was a conversation about bias, and for sure, if your data set is biased, you've got a problem. But to your point, there is the sort of flip side of that coin is, do we suddenly have an opportunity to use data sets that never have been used before to inform these decisions and actually make for improved outcomes, access, and everything else. And so I think some of those specialized world, be it care for rare, pediatrics, and others, there are huge opportunities that whether they're hyper real is yet to be told, but a lot of people are counting on and hopeful about.
So maybe now we'll turn it, unless anything else between the panelists?
I have a question that I may look like a fool, but I'm going to give it a shot. As I was doing the analysis on all of this, I was struck with the fact that AI isn't actually all that new. So I kind of went looking at Kumanan here on this one, but I mean, historically in medicine, we've used large amounts of data to help us make decisions and try to make things better. So is AI really, what's so different about AI except that the data sets are bigger and the analysis is a bit smarter?
That's a great question. I'm still having trouble understanding that as well. I keep asking my biostatistician what's the difference between AI and machine learning and what we've been doing all along, and it just does seem like a more advanced form of analysis, but I know you guys are AI experts, so.
I think the way I view, pardon me, machine learning is that it kind of sits along a spectrum. On one end of the spectrum is the good old-fashioned logistic and linear regressions, which are a simple form of machine learning, which we've been using for decades, at least. But I think what's unique about modern deep learning in particular is that it finds patterns in data kind of automatically without us having to tell it what to look for. So I can give the example from the first company I mentioned, Winterlight. Like we did kind of an old-fashioned approach where we said, we're trying to find signs of dementia, and we know that people with dementia, they speak slowly, or they use more pronouns than nouns, or their pitch is flatter or something. So we had to write all these little algorithms that would pull that out, and then those would be put into a variety of machine learning models, including logistic regression, which worked very well, and that's not too different from what's been going on for a very long time. What's unique about deep learning is that you don't even have to do that first step at all. You just give it the raw audio and tell it, I'm looking for dementia. As long as you have labels you can believe in. And even if you don't, even if you have, another good thing about it is you can have a ton of unlabeled data. If any patterns exist in the data, the neural network will be able to find those. So it kind of does feature extraction for you automatically. Features that are unique to what you're looking for. That hasn't really been done before with logistic regression.
So, so to make it clear, I'm a chemist by training. I worked in government. I am not a computer scientist, but maybe more from a strategy policy perspective. What AI is bringing to the table, I was looking, I couldn't find it in my notes, but Minister Baines, when he announced the SIF Stream 4 results, just maybe last couple of weeks, I think he said his estimate is that we use 0.5% of the data that are around us. So we have data in health not because we wanted data, it's because we didn't want paper processes anymore. And now we have all kinds of data, and a subset of that, with appropriate preparation, can be turned into knowledge that can improve health and well-being and even save lives. So here's an image that really stuck with me. We had a guest speaker from Columbia come, and she put up a picture of an ICU room, and there's a screen here and a printout there and a chart there. And she said, this is one of the few exceptions where they actually capture the data, and there's the potential to analyze it after and turn these swirling data into signals that people should be acting on. Most of the time, unless someone's in the room right there, processing all of these different data sources in real time, it's just gone. It's exhaust. Nothing's coming of it. So I think that's what's inspiring people when we think of the benefit, not to reduce ourselves to the data that we are, but when we think of that data that can be really making a meaningful difference, and now we have the computer science tools, the cheap compute capacity, that's what makes AI different in my mind.
Risk-based approaches to evaluation and the benefit, asking out the benefit, but who gets to decide what the benefit is? Many of these innovations may not have the kinds of trials that would look at morbidity, mortality, impact. In fact, many of the benefits might not be around mortality or morbidity, but around other factors like early detection of conditions that people worry about. So my question is, it seems to me that one of the missing pieces here, and it was mentioned in one of the earlier panels, is what is the public, what are the public's values and views on these questions of what are the benefits that matter, what are the risks that we as society should be willing to take in order to potentially get those benefits. My question to the panelists is, how do we engage the public meaningfully in these discussions? We're in a room with all sorts of experts from all sorts of fields. We're all members of the public, but we don't really represent the public here. We're representing our areas of expertise. And how are you aware of good models? Do you have ideas about how we can effectively engage all of various publics in this conversation in a meaningful way?
There you go. So at risk of oversimplifying yet again, at the hospital we have family advisory committees, youth advisory committees, and again, I just see AI as what we already do on steroids. And so it's those families that are telling us what we're not doing well and giving us ideas. So we are terrible at estimating length of stay. We know that kids come in and we tell them, oh yeah, you've got pneumonia, you'll probably leave in 3 days, and then it takes 2 weeks because things get complicated, and they hate that because setting expectations appropriately and things like that. So these are all areas where AI will be one of many tools that we will use to solve those problems. But we're not really in a situation yet where we're like, AI is my hammer, what problem am I going to solve? We've got way too many problems, and we're looking for AI to help us solve the existing problems, not take AI for AI's sake and making up new ones.
Sure, I'll take a stab at that as well. I mean, I'm a big believer in getting products out to the public. So, the Agile model is to get a minimally viable product out there. And you'll find out there what the public wants. Like, first of all, if they don't use your solution, then you know it's that they don't like it. With Google Analytics, you really have a good sense of what they're using, what they aren't, and you also get a ton of feedback, which is really helpful. I actually think, that's been much more useful for us than any focus groups or interviews we do. This is real world data. Now, it doesn't answer the question of benefit. There is two levels of benefit. There's usefulness from a consumer perspective. So if it just makes their lives easier, that's beneficial. That's something we don't think of as researchers. Like, if we can just make their lives easier in some way, it doesn't necessarily have to have a health benefit. But then there is actually the health benefit. And this is, I think, the US model of the post-market surveillance, which I think is going to be much more easy with the digital tools because we have global data sources, we have the analytics from the device itself. We can probably have a more rapid post-market surveillance cycle that could actually start to evaluate. So I think we have the two things. If you really want to know what people think, you have to get the product out there.
So I met Chad Gaffield a few days ago. He's a professor at University of Ottawa. He's currently the president of the Royal Society. He gave us a talk about how we ensure that AI is going to be used positively. He had 7 points, which are published. You can find them online. And the first two are with regards to how we talk to the public about AI. The first one was mostly about how generally when we talk about AI or when you read about it in the paper, it's usually couched subconsciously in negative words. So we talk about the deluge of data or the risks of AI. And it's usually as these kind of negative terms that kind of bias your Broca's area when you're reading these things. So the first step is to just try to maybe use more neutral language. And the second point is certainly not to use overly flowery language. The second point he raised was we should, like I tried to mimic earlier also, we have to try to ease up on the hype. Because another thing you see a lot in papers is like, smart cars are going to be on our roads any minute now, and robot doctors are going to operate on you, and that's not going to happen anytime soon, to be honest. So we have to, be less negative, but also be less, cheerleader-ish.
Just a final point to answer the question about models out there. So what's interesting about these concepts of data trusts that are being explored are the governance proposals that are being put forward, not unlike the governance proposals we know, we've learned, we've practiced, and we've implemented in the area of biobanks, for instance, where you have an overarching sort of governance of the stewardship, not on a project-by-project basis, but in the general sense of how and for what purposes and to what ends the data in the trust will be used. And so I think there are lots of examples of decades past of how to engage public in those broader governance models. And that's particularly true of the public sector and particularly true of these models that are going to look at the interface between private and public sector. Just a final note, the private sector too, I think, is incredibly sophisticated and able to assess consumer needs when it comes time to selling products. They have sophisticated focus groups. They are very, very good at that, and they have the models. And I don't see why they can't be deployed in order to get a better sense and a better grasp of what consumers think about not only whether they'll buy the products, but whether or not they're acceptable.
Patricia said the final word. I'm just going to add as well. I mean, Michael, organizations like ICS that has now a corporate public advisory group, that's a model for sure. Plain language communication with the public is going to be key to this. And I was at a UK-Canada symposium on ethical AI, and it was funny, around the room, we said, who's got a good go-to resource that is objective about AI, not just in health, but, that's not, Fantasyland or dystopia, and that is also not, and here's how you learn how to code, here's the online course. And no one around the room had anything. So I think that's a gap that collectively we need to work to address. What's that objective, 2-page, 4-page, 10-page, that for the general public we can start having a better and more informed discussion. Colleen, did you have a question?
Yeah, I did. So I wondered if Frank and Kumanan, and perhaps you, Pat, reflecting on the innovators that are coming in your door, if you could change one or two things presently about the environment, what would that be? So just to get a bit more concrete here about what actually needs to change from your perspective to actually make AI innovations get out the door and into the marketplace or into the public healthcare system.
When innovators are coming into our door?
Well, you're the innovator, right? Kumanan's an innovator. Pat advises lots of innovators. From your perspective, what needs to change, or is it all tickety-boo? Two things.
So it's not all tickety-boo, but a lot of it is. I think when Winterlight or Surgical Safety goes out and talks to potential partners, usually they find people who are sort of like interested in cutting-edge technology. In Surgical Safety's case, they find surgeons in particular who are interested in novel ways of improving their skills. So the first thing is to find early adopters. And so far, both of those companies are still pretty much, even though they're across various continents now, they're still mostly working with early adopters. I think, which is great, and they've been helpful to us, and a lot of them are key opinion leaders. There's a next step, which is convincing people who are more skeptical of it that there's some benefit of it is the real thing. So making sure that we can set expectations properly, right? And also, this communication is sometimes a thing we're still working on. It's really cool now that, like when I was a student not too long ago, it was most computer scientists working only with computer scientists. And now we're seeing a bit more cross-disciplinary talk like this meeting, which is great, but we still have a lot of differences in how we communicate to each other, and we use words that might not be have the same definitions. These skeptical people who are hearing AI people talk about all these cool new things that neural networks can do have to, listen with a grain of salt in their ear or whatever, and realize maybe I don't know exactly what they're trying to tell me, and like I said before, it's maybe too much to ask to talk to a computer scientist, but as you do, you'll learn more about how we communicate some of these things.
Okay.
I think this is the tension, and I think it's well reflected in the U.S. documents on thinking this through, that we need to regulate, but we also don't want to create barriers to market. And the paradox is when you create regulatory barriers to market, it doesn't really hurt the bigger companies because they've got all the resources. It kills the smaller companies. So the bigger companies are actually pushing for that. They want these high standards in place because the small companies don't have the resources to spend on privacy lawyers and everything. So, I believe the U.S. is the only country really with a firm regulatory framework on this, and I think Canada will probably be number 2 from what I understand. But I think right now the environment's pretty good because there aren't many rules right now. So we're all sort of doing our thing, but eventually rules will come in, and that could kill a lot of companies if we're not careful. And so I think being aware of that, and everything I've seen so far in the dialogue seems to there's a recognition that's a reality, and they don't want that to happen. They don't want to put in a bunch of rules all of a sudden that's going to kill a bunch of particularly small, medium-sized enterprises. So I think that's the thing we need to really be careful about as we move forward.
Kuna, can I just push you on that? We already have a whole bunch of rules, right? So we have Health Canada doing regulatory approval. It's not like there aren't rules now. It's just they're not specifically designed for AI, but they're in place. We have privacy laws that are in place. So we already have rules. So it's not so I'm just wondering in terms of the space that we're in, I hear what you're saying. You don't want more or over regulation, but where we are now, what needs to change, if anything?
I would I would like to just point to an interesting model of that's being explored in the UK, particularly around these regulatory sandboxes, where it is a more safe space between the regulators and innovators to come and have truthful and experimental conversations and demonstrations and proofs of concepts in an accommodating, forgiving way until they get it right. And so I think for that to happen, there's two things. One is the regulator has to be more forgiving of this space and more accommodating and not be so quick to respond with the hammer and say, gotcha. And on the other hand, I think businesses and innovators need to be a little bit more trustful that they can go to that safe space and have a truthful conversation, open the kimono, so to speak, and really genuinely look for a solution in concert with the regulator. So I think that opens up a lot of opportunity to let safe innovation proceed. And I think we should explore that in Canada.
I agree with what Patricia has said. The one thing I'd add, and we've had this discussion with Health Canada, is the nature of all the things that have to come together, superimposed on these small companies led by scientists. It's probably pretty hard for them to process. So probably we need to have a few things go through a regulatory sandbox first, but then if we could make like a dossier, even for a fictional company and a fictional technology, and basically say, this is the kind of thing you're going to have to submit to get your product into use, that might speak a little bit more the language of the entrepreneurs.
And I'll just jump in, very much on the ground and not in frameworks and sandboxes, but health IT is consolidating, and there aren't that many vendors anymore. And so if you're embedding AI in the tools that people are already using, so whether you're a startup and you're partnering with someone else, but for PACS, for example, we're just buying a PACS. The fact that it includes AI, the RADs are thrilled, but it wasn't a big decision for our organization to say, yeah, now we're in the business of AI. And so I do think that partnering with tools like Cerner and Epic and others that are already in the healthcare space and embedding that expertise and knowledge in systems that people are already using is a very quick way to get to market versus me having to try to sell my hospital on, I'm going to bring this startup in and we're going to take some risks because it's AI and we need to figure out how it fits in our corporate architecture. And so another hurdle for those startups is the fact that we've already sort of standardized and made investments in systems that they're going to have to play nice with if they want to go to market.
So I just want to come back with one quick thing in response to Pat, and I think we're seeing this with the FDA and possibly with Health Canada, this idea of this regulatory sandbox and working with industry. And, I think that can be very problematic as well, right? So we are always concerned about things like regulatory capture of the regulator being captured by the industry and starting to work in the industry's interest and not in the public interest. And we've had concerns about that on a number of fronts, both here and internationally. So there's that concern. And then it seemed to me that if I was an innovator, what I would want is a bunch of clear, straightforward rules that I know that I have to comply with and that it's not the length of the emperor's foot. So all this idea of messing around and playing with it and adapting it, whether it's tough or whether it's light, as long as I know the rules, then I know what I'm dealing with and I don't need to spend, bazillions on lobbying, lawyers and et cetera, et cetera. So I think there's the other side of that coin there too, Pat, that I think, anyway, but I'm not an innovator. I'm just a laid-up academic who would like to be an innovator.
I think,
So
sorry, just one last point, Colleen. I think you're right. And I think predictability and certainty is a great friend of innovation. I think it's probably a little too early to regulate at a granular level. But what I would be a proponent of is I think it would be much easier to come together in unanimity to determine the no-go zones. I think the no-go zones are a great place to start because I think that's where you can get a lot of uniformity and a lot of agreement, where we just agree that as a society, these are the outer limits beyond which we will not go. We've done it with cloning. We've done it with human-animal chimeras. We've done it with designer babies. We just don't want to go to those limits. We can do it for AI. And I think once you get those parameters around, I think you start to build trust and you start to bring down the worry that organizations or developers or innovators will go beyond those parameters. And I think you can spend your energy then working within agreed upon universe. That's my view.
And if I can just say briefly, I'd like to support this checklist idea. We have a lot of people coming to us asking us questions because nobody really has any understanding of how this all works. Like, are you a medical device or not? It'd be nice to have a clear checklist to determine, because once you're a medical device, things change. This whole question of whether your data should be in Canadian or U.S. soil, that's all because of Homeland Security, but it's an American company anyway. So, nobody knows really the answer to that question. Like, there are all of these things that are sort of uncertain and we're guessing. So, yeah, I think a checklist would be great, that could simplify it. And I think you're right. It would make things actually easier for the innovators if you said, if you do this next thing with your product, you're going to start increasing your regulatory requirements substantially. So that might actually push an innovator away from going in that direction.
Oh, we have one more question, and then we'll go to the panelists for their closing remarks. Michael?
Well, just a practical question. There already is this whole field of SAMD, software as a medical device, that Health Canada is already obliged to regulate. So how would you, Patricia, say, well, here's the no-go zone when these things are coming in the door at Health Canada already?
Sorry, Mike, I don't know which in particular you're referring to, so I don't know, but I do think that we are, and I'm saying universally, I think we can, with all the principles that were raised yesterday and today, and all the work going on internationally around building ethical frameworks around AI. I think it's Susan Gibson at U of T is looking at all of these, and actually part of her work is in looking at the commonalities. And the commonalities emerging from all these frameworks are incredibly similar. And you can find very universal principles that are emerging across all these different efforts. And so I don't think it would be that hard to scope out those no-go zones. And even if we wanted to say no-go zones for now, until we get a better grasp of the technology. I'm speaking from my former perspective as a regulator. It's always easier, I think, to go to that first, and to set the four corners or the parameters, and then there's a lot of discussion about what goes on inside. But I think it would be much easier than we think to come together as a society, as an international society, to actually set those four corners. I don't think that would be difficult.
This might not be, the full scope of what no-go could be, but here's one that I would put forward. Nothing should be approved unless we have basic demographic information about the people that it represented in the data set that the model was trained on. And so you could say to someone, look, if your data don't have that, then there's a risk, for example, like women and heart disease, that we're going to come up with something that actually does harm, and therefore we will not consider or approve things without that. That's just a really narrow point. But I do like this idea. It's sort of similar to choosing wisely in some ways, of saying, are there some things that we can just put out there? Don't spend your time on that, so that we are focused on the things that are most likely to move forward. Okay, so as promised then, we will ask panelists. I'll just see if anyone wants to volunteer to go first, if they just have, a minute or so, a few lines of closing comments. Frank looks ready with the microphone.
Okay. So I'm generally like a fan of regulation a priori. I think a lack of regulation in the States is what we saw might be related to the collapse of the news media in that country. That being said, I don't think it's a good idea to necessarily try to feel you have to do something before you've really come to terms with what that thing is. And regulations, we start putting on AI without fully understanding what AI or machine learning are, might provide more harm than benefit. The second thing is, I think, Canada has sort of been like a resource economy for a very long time. First it was beavers, and then it was oil, and now to some extent it's the brains of people coming out of computer science departments. And right now what we're seeing is a lot of these big companies moving to, Edmonton and Montreal and Toronto, and they're basically extracting ideas from the people who live and work there. And then, sucking it up to some big, amorphous cloud internationally. And I think this is a bit of a danger because eventually the AI bubble, it won't burst like it did in the 60s or 80s, for those who remember those periods. But it will sort of just kind of deflate gradually. And those companies might not put as much investment a decade from now that we have now. And I don't want, Toronto and Montreal and Edmonton and other cities to become sort of AI ghost towns. Like from the gold rush. Moving forward, we have to, I think, make sure that any regulation we come up with, first of all, is motivated by facts and a deep understanding of how things work. But second, we want to foster our own innovative companies locally to grow, so we're not just sort of, sending our natural resources out of the country.
I think your suggestion that came out here for the checklist are going to, I think, a really great idea. I'm be interested to see how you do go about in regulating this stuff, because this stuff's changing so fast, and today it's machine learning, and then it's AI, and then it's blockchain, and then who knows what they're going to invent next year. And even with regulating these, software of the medical device, that device changes the next week. So what are you regulating? You're regulating, stuff that's always changing. So I'm really interested to know how the people around here are going to figure out the solution for this. I know there are adaptive models that have been tried in other areas, but it's an exciting time, but it's going to be a real challenge for your community.
So as I've made clear, really to me, AI is really just a logical extension in healthcare, and happy to debate where sort of human imagination ends and AI begins. But my favorite takeaway is actually this concept of an ethical impact assessment. My friends from Sick Kids sitting here at the table can attest we're in a partnership with Sick Kids, and the privacy regulations we had to go through were not insignificant to live in a health information world together. And there are days I have argued that the privacy risk is by far outweighed by the patient safety risk. And if we could use an ethical impact assessment rather than a privacy impact assessment, we may have made different decisions. And so a framework like that to help us figure out what we can and should do is going to be really important regardless how we implement AI.
So I'm just going to close off on two proposals, and I haven't thought this through entirely, but two no-go zones that I'm just going to posit for a moment just to keep us thinking about this. One, I think we can learn from other areas, particularly from genetic testing and whole genome sequencing, where we've learned out of compassion to allow and respect people's right not to know. So as AI develops and is able more and more to predict our future behaviors, our future health, our future illnesses, our future choices, with such perfect accuracy, I think we owe it for the sake of retaining a sense of human agency and a sense of human flourishing to allow people the right not to know these things. And I think we should talk to people like Brenda Wilson, who've been working in this area for so many years, when we, talk about results of, Alzheimer's or Huntington's disease, and decide to respect people's right not to know that and to be able to flourish and make the take their life to the fullest capacity. And the other area I'd say is I think there are certain areas or decisions that we just don't want to allow AI to nudge too far. I mean, we talked about diagnosis, we talked about predicting, we've talked about taking it incrementally, but we haven't talked much about the nudging step, where more and more the capacity for technologies nudge us into decisions, and again, jeopardize their sense of human agency. And one area that I think has struck a chord with very many people is we just don't want to be nudged into into making decisions about our democratic right to vote. I think that's one area we've just said, no, that's going way too far, and we don't want that choice to be meddled with and to be nudged and pushed into a certain area or a certain decision. And maybe there are other areas of our lives which are a no-go zone, and we can think about that in the human health area. But I'll leave that with you for some reflection.
Well, thank you again so much to all our panelists. Thank you to you. And I have the